right, good Thursday morning. Welcome to the WLBB Community Voice program here on News Talk 1330 FM 106.3, also streaming live online at newstalk1330.com. And this morning, we are on the News Talk 1330 WLBB Facce book page, where you can already see my guest. We survived the big storms, wink, wink, last night. And, I'm glad we didn't have any. I'll tell you, honestly, I called Tim Padgett every time we get these big storms and talk to him beforehand, and the last few times he said, yeah, it's a good chance we're not going to get it. He's always confident, and by golly, Tim Padgett was right again, Carroll County's EMA director. But he is not our guest this morning, and I'm going to try and stay focused. I'll admit I'm knackered this morning. I'm pretty tired. I'm going to try and stay focused on our guest because it's a very interesting story. Dr. Brent Harris, he says he is setting up an exploratory committee for a run for Georgia's governor office, and that'll be for the year 2022. So this is probably the time to dig into it if somebody is really considering that. Dr. Brent Harris, good morning.
Good morning.
And
thanks for having me.
It's cool you're coming out to talk about it.
Yeah.
I guess this show can kind of be an exploratory committee. It gets you out there and you see the feedback on Facebook.
This is the exploratory show.
This is the pre-exploratory.
Yeah, the pre-exploratory interview.
Now that group, the exploratory committee, when you put that together, is that mandatory to seek a state office by chance?
I don't believe it's mandatory. I mean, I think it's one of these things where the whole system is relatively complex, and it relies on, you're going to have to rely on a bunch of people to help along the way if you're serious about it.
Mm-hmm.
And so that's the goal of putting a committee together from that have different interests, different capabilities, different allocations at times. You can say, okay, I got a finance guy, I've got a legal guy, I've got a social media person, I've got someone that's attached into the legislation already, so they kind of know the governor position and what all it entails.
How many people will you have in this group, exploratory group?
I don't know yet.
Have you talked
Yeah, right now we have about 8 people, and so I'm sure it'll blossom from there. So we're in the preliminary stages of it.
What do you hope to learn from that committee? I mean, are you putting out pictures of your face, you smiling, and then grumpy face, and see if people, all right, trust you there. I mean, it really is that. I mean, there are really precise things they do in these committees, and they test. But what do you hope to learn?
Well, I think the big thing is let's look at the landscape that we have currently. Is the landscape that we have currently conducive to a successful governorship? And then also see, okay, what all does it entail? How much finances are we talking? Are we talking $1 million? Are we talking $10 million? How many personnel for a solid ground game? I mean, is it 1,000 people? Is it 10,000 people? And so kind of get a resource allocation, a preliminary list of, okay, what exactly are we looking at? My buddy Jimmy Pace, growing up from childhood, his dad, James Pace, he was a developer out of Peachtree City. He ran a couple years ago for I believe Ferguson's spot. And so he was close. I mean, he sent a chunk of his own money, and so I understand that that's going to be part of it. Okay, how much does it, entail? Are we talking, $250,000? Are we talking $1 million? And so, we got to start somewhere.
Well, you say $1 million or $10 million. It's likely to cost more than that. But does that worry you? I mean, you think about those numbers. Are those not mind-blowing numbers? You think about investing?
They're not mind-blowing numbers to me. I mean, to me, I look at it things like a business person or an economist. So I mean, it's just a value proposition. It's basically how many economic inputs do you need to get a certain output, if that makes sense. Mm-hmm. And understanding that I'm essentially a political nobody in the world of Georgia, and so I'm up against huge odds, and understanding that, kicking it off, I'm well aware of that.
Mm-hmm. Are you looking back to 4 years and thinking that perhaps a political nobody can catch the interest in the hearts of voters? Does that mean anything to you, that it kind of happened 4 years ago?
I think it does. So when I ran for Brett Ledbetter, I'm essentially a relatively...
Well, I'm thinking for the presidential election.
I was on the city council thing when I ran a couple years ago. And so... Well, Trump is different. Trump is a well-known.
He was well-known, sure,
individual. So that's two different ballgames.
But didn't have that political background at all.
He did not.
I didn't know if
correct.
you were grabbing onto any kind of hope there. Saw that as I don't know if an inspiration, but maybe saw that and felt like.
No, I think it's one of these things where if people that care about the country at large don't get involved, even if they are political nobodies, then what's the point of having a representative, government in this country? And the concept isn't, okay, I have to win to have a successful campaign. That's not the goal, right? I mean, that would be a nice goal. But at the end of the day, even political nobodies can come into the political arena and bring good ideas that maybe somebody that's going to win
can champion
in. And so if somebody's not willing to step up and bring up new ideas about how to tackle certain problems, they may never get addressed.
Mm-hmm. Dr. Brent Harris, our guest on this morning's Community Voice program. He is setting up an exploratory committee for a run for Georgia's governor's office, and kind enough to talk about that with us this morning. Let's go back. Let's reintroduce you. I know my segues are terrible this morning, but let's introduce you. You're Carrollton resident, U.S. Med Clinic down the road operating it. Tell us about yourself and your family.
Sure. So, Dr. Brent Harris. I went to Berry College up in Rome, graduated from there, and then went down to Mercer Medical School, spent a couple years in Macon, then a couple years in Savannah. And then my wife and I actually got married during medical school, so she's a physician as well. And then we moved over to San Antonio, Texas for residency. And then we came back here in 2012 to practice medicine. And soon after coming back here, about 6 years ago, I set up U.S. Med Clinic, and it's an affordable direct pay medical clinic to try to help people that don't have insurance or have high copays, high deductibles, have a more affordable option for health care. And it's done really well since. We have several locations now, and branched into other ventures in the community. Started a Montessori school with my wife. We want really a high quality problem based learning. We don't want a lecture based learning for our kids. And then real estate investments. Pretty much reinvesting 100% of all income back into the local community is my goal. I don't hold a stock portfolio. I don't have any special interests, affiliation, that kind of thing. So.
Dr. Brent Harris, our guest on this morning's Community Voice. Your motivation then, what, I guess, is something you've been thinking about a long time, or did you just wake up one morning and see an issue and say, you know what, I want to try and change that myself on a bigger level?
Well, I think everybody local knows that I've run for city council a couple times. The first time I got pretty much creamed when Rory Wojcik ran, and it was a runoff between him and Wes Phillips. The second time when I ran against Brett Ledbetter, I think he came out much earlier from a timing standpoint. So he carried the early vote, and I believe I actually carried the day of the vote. So, I think there's a lot of value in getting out early and getting, letting people know who you are and what you stand for. And so that's my goal here, is to kind of come out early. Hopefully, as time progresses, there'll be some degree of a swell of interest and support.
When can you publicly start putting out signs and things? Is there a law on that in the state?
Exploratory committee time.
They'll present all that information for us. Good. Hey, Dr. Brent Harris is our guest on this morning's Community Voice program. Again, he's setting up an exploratory committee for a run for Georgia's governor's office, and it's a cool thing. To have somebody from Carroll County, from Carrollton, to consider that. And obviously, we'll keep an eye on that over the next couple of years as that progresses. But, hey, let's take our first break. I know we're on the Facebook page live this morning, so I'll take a peek there and see if there's any questions and comments, and I'll share those on this program. Time right now is 8:38. Community Voice is brought to you by Tanner Health System, Oak Mountain Academy, here on News Talk 1330 FM 106.3.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
Oak Mountain Academy would like to invite you to join us for our 33rd Annual Spring Gala. This live virtual event will be held on Saturday beginning at 6 p.m. Professional superstar auctioneer Seth Weiner will be our host for the evening. Seth will guide us through the live and silent auction portions of the evening and facilitate a variety of games where the winners take home prizes. If you love a good scavenger hunt, think you can name that tune, or are a bingo champion, you won't want to miss this free event. Register today at oakmountain.us for a virtual evening of fun, games, and entertainment.
What's up? All right, welcome back to the WLBB Community Voice here on News Talk 1330 FM 106.3, streaming live online at newstalk1330.com. And this morning we are on the News Talk 1330 Facebook page. I encourage your comments and questions, and I will look at those when I get a chance and share them with our guest. His name is Dr. Brent Harris. He's Carrollton resident says he's setting up an exploratory committee for a run for Georgia's governor's office, and we do appreciate him discussing that this morning. I would imagine that that healthcare might be something that you're pretty competent in explaining and considering in the future, and could become part of your campaign.
Yep.
What do you know, Brent? What do you know about healthcare? Are you content with the healthcare system in the state of Georgia?
Well, I mean, overall, I think we have relatively decent health care in the state of Georgia. I want to run on kind of the affordability of it, and also, across the board, we need better institutions for information transmission, especially in times of like pandemics, like what we just went through. But I'll start with the first one. So affordable health care is a noble cause. I mean, it's very complicated because it's regulated from the feds and there's some regulations from the state. So if you get involved at the state level, you can really only attack a part of it, but at least if you attack part of it, it's better than nothing. Okay, so one of the main issues is like CON laws at the state. So those are certificate of need laws. And they actually ran a couple years ago talking about some legislative changes to them when like CTCA was coming into Noonan, which is Cancer Treatment Centers of America. And really what the CON laws do is it regulates essentially local monopolies in healthcare systems. And so, for instance, if you wanted to put up, my buddy's a radiologist and he wants to put up an imaging center, for instance, a direct pay imaging center that charges a flat $300 for a CT scan and $500 for an MRI. He actually has to go to the state and apply for a CON license to essentially open one up if he has a location. And if he doesn't get that CON license or certificate, he can't open it up.
And that affects accessibility too.
It affects the accessibility and the pricing. So if you're a local hospital system and you have essentially a monopoly on the system, you can charge whatever you want. And so people actually have to leave your area to go get that service. Whereas if those CON laws didn't exist, they could build one local. Does that make sense? Mm-hmm. And so I think they need to do that across the board because I'm kind of a free enterprise individual. I think competition actually drives prices down. So I think there needs to be competition in the insurance market across state lines as well as with local health systems. Things like images, outpatient surgery centers. Now there becomes an issue to some degree, and the hospitals really, fight back against it because they're forced to do charitable care to people without insurance. And so you'd have to set something up. So if you have laws in the book where it forces local hospitals, their local ER to take every single person no matter what their insurance status is. So all the individuals with no insurance may go to the local hospital, but if you set up a private emergency room next door, that's where all the insured people might go, or the people with high deductible or high copay systems. And so you'd have a funding mismatch between the local public hospital authority and the private institution, which you wouldn't want, right? So you'd have to have some kind of funding subsidy that would cover your uninsured individuals. Okay, mm-hmm. So right now we have some degree of Medicaid and other things like that. So, but that'd be something you have to actually dig into the actual numbers on that issue to really make it a definitive decision on it.
Any kind of speculation on where that money would come from? Do you need to raise taxes?
I don't think you can raise you don't have to raise taxes at all. I feel like everybody spends a lot of taxes right now. Across the board, and that's with tickets, fines, driver's license fees, plate tags, property taxes, income taxes. I mean, if you add all the taxes up, everybody's probably spending 50 cents on the dollar on taxes and regulatory fees. Mm-hmm. And so I think there's plenty of money in the system. I think what you have to really focus in on is all the pork spending, all the excessive spending and inefficiencies in the system. That's where you go after the money. You don't try to just squeeze the population for more money.
Dr. Brent Harris, our guest on this morning's Community Voice program. Over the last year, during the pandemic, you've done a lot of videos on your Facebook. Mm-hmm. If you follow you on Facebook at all, you'll see a lot of comments and a lot of studies that you've done and a lot of stories that you reviewed from other places. How do you think Georgia handled distribution of the vaccine? There are reports that we're bottom in the U.S. as far as getting that out, delivering that to people.
Yeah, that's one of the reasons I'm running is because I think overall, the part of the pandemic response was done very well. Okay, so Operation Warp Speed at the federal government for vaccine design, production, and delivery That was an exceptional accomplishment, okay? Then getting down to the local level for distribution and allocating information, that's horrendous, okay? Because I actually applied to multiple parts of the DPH for Georgia, for my email chains to say, hey, I'm emailing you, please email me updates so I know when testing is available, what I can do for uninsured individuals, how do I allocate free testing, et cetera, when am I going to get vaccines, that kind of thing. Mm-hmm. And there's essentially minimal email or notification with regards to that kind of thing. And so the vaccine distribution is a perfect example. So right now you have a group of medical providers in Georgia, all the primary care physicians, that know what their populations are. They could pull up their EMR systems, their electronic medical records, and say, okay, we want all the patients from 65 and above. Okay, you could print off that list and start calling those people and say, hey, we got a vaccine ready for you. Okay, and they already have a physician, they already know where to go. They could come in and get it done. If you distributed the vaccines, and you'd know a number too, right? You'd know a number of patients for each clinic. Mm-hmm. So you could have these major medical distribution systems like McKesson Medical Surgical that distributes to almost all physicians anyways. You could give them pallets of vaccines and they could allocate, 100 to Dr. Harris, 250 to Dr. Taylor Gordon, 275 to Dr. Charles Davis, et cetera, et cetera. And then you don't have bottleneck situations like the public vaccination sites, mass vaccination sites, et cetera, et cetera. They're already proven professionals in medicine, so they know how to handle an adverse reaction, right? You don't have to hire anybody. You just have to distribute to where it needs to go. So it's actually an easy solution, but that wasn't part of the solution. Basically, their solution was, let's allocate it to the local hospital systems first, which is essentially frontline workers, which I think is appropriate, right? And then let's allocate it to all these pharmacies, but not the local small pharmacies, the bigger pharmacies, right? Your Publixes and Walgreens and CVS's of the world. And that sounds all well and good, and I think it's a supply chain issue where they say, okay, we can distribute 1 million vaccines to Walgreens distribution center, and then they can shell it out to all their stores. Well, the pharmacists and the techs at those locations, they're already kind of strapped somewhat for time because they're in the business of distributing drugs, right? And so you're just adding something else onto their plate. I think it'd be so much easier just to distribute to all the primary medical providers in the community and go that way.
Dr. Brent Harris, our guest on this morning's Community Voice program. Obviously, it's easy to talk about the COVID pandemic with him a little bit, but he's setting up an exploratory committee for a run for Georgia's governor office. And if you missed any of this program, I encourage you to go back and find it on our website at newstalk1330.com, also on the Newstalk 1330 Facebook page, where we are live right now, and I encourage you to post any questions or comments up there. How about the fact that, we talk about the tiers where it was distributed, the decision to get it to the people who were 65 and older first after healthcare workers, was that the right decision?
Yes. All the older individuals is definitely the priority. If you look at that mortality information, your mortality rate for COVID is all the elderly individuals essentially. You hear about people younger dying, but the great majority of individuals have comorbid medical conditions, and they're older individuals to start. It's just the nature of the disease.
Mm-hmm. Well, we talk about age being a big factor in morbidity, but did you find anything else that would suggest why somebody would have been sicker than anybody else when they had COVID?
Yeah, so weight has a big thing to do with it, so being overweight. And there's probably a correlation between that and immunosuppression or your immune system competence. So you don't have quite as competent of an immune system if you're overweight. It has to do with some of the inflammatory markers in people's body. Vitamin D deficiency, so there's been some different studies on that result, but one of the big one is a vitamin D deficiency. And as you get higher up in towards the poles on both sides of the world, you probably have a little bit higher mortality rate just because of the vitamin D deficiencies above the 35th parallel, I believe. And so I know in our treatment protocols, we always gave people a big lug of vitamin D, a bolus of vitamin D, and then daily vitamin D along with other things we were doing.
I was going to ask you about your treatment, but that's good. We had a gentleman that works with us who did seek treatment from you, and apparently he's skipping and hopping around
That's good.
and doing much better.
Good.
Time right now is 8:50. We're going to take our final break. We'll come back and we'll ask some more political questions to kind of get your idea on some things that are going on in the state of Georgia politically at the moment. We'll take our final break again. We'll come back with about 8 minutes. So I do encourage you to post on the News Talk 1330 Facebook page any kind of questions or comments you'd like me to share during the remainder of the show. Community Voice brought to you by Tanner Health System, Oak Mountain Academy on News Talk 1330 FM 106.3.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. From pre-K 3 through 12th grade, our school encompasses a family-oriented atmosphere. Our faith-based value system works as a foundation for supporting our honor code, while our academic standards prepare our students for college and beyond. I'm Patrick Uran, headmaster, inviting you to join us for our virtual admissions open house on Thursday, April 1st at 9 a.m. Register today at oakmountain.us.
All right, welcome back to the Community Voice program, News Talk 1330 FM 106.3. My guest this morning, Dr. Brent Harris. He is setting up an exploratory committee for a run for Georgia's governor's office and for the year 2022. Talking to you during the break, and I forgot to look at the questions on our Facebook here. Juan Carlos Ferrero, what do you think about the January 6th insurrection to the U.S. Capitol? Should the Georgia governor work to establish an anti-racism curriculum in our schools? So 2 questions there.
So the first one was the insurrection, right?
Yes.
And the second one was racism.
Well, should
education.
Georgia governor work to establish an anti-racism curriculum in public schools?
I mean, I wasn't up at the insurrection. I didn't really follow it that much. I think anytime you have a breach of a federal building, that's a big no-no and inappropriate type of behavior. The simple fact that anybody died is an absolute travesty. So none of that should ever been allowed to occur. I also think from a leadership standpoint, you have to be real careful with what you say because people's perceptions are different. Okay,
I think even using insurrection is probably offensive to some people.
Yep. So that insurrection word has already skewed and kind of said what I'm supposed to, how I'm supposed to reply. Right? It's already a negative connotation. It almost puts a criminal twist on the question, which is fine. That's their perception, right? That's why the question is asked that way. But getting into the overall trust and perception of the system, I think there's a massive problem in general across both parties. So this is Democrat or Republican, the 2 major parties we have. There's a massive trust, and it's a perceptive issue about the other side, right? So if you get a group of Democrats together and you ask them, hey, what do you guys think about Republicans? They'll say, oh, they're a bunch of, racist white people. And then you get a bunch of, Republicans on one side and ask them what they think about the Democrats, and they'll say, oh, they're just a bunch of progressives that want to, spin us into oblivion and destroy the country, right? And there's probably a little bit of truth to both sides of that because perceptions usually have some degree of truth to them, okay? There's somebody somewhere that says something that kind of alienates their opinion on the matter. And that what we need to do is try to pull both sides some degree to the middle, because really America divided is weak and will fail. I think everybody understands that. If we have 2 major factions in this country, from a political standpoint, the country will head towards a civil war of some type.
It feels like there is that effort to keep us divided.
Right. And I think there is that effort to divide because when you divide 2 groups apart, you can have leadership in both groups to be, the champions of those groups, and they support those. Does that make sense?
Yeah.
We really need somebody to come together and pull both sides because there's actually good ideas on both sides. So take education, for instance, right? The downtown, failing public school type systems, nobody likes them, but the leadership on those places like them because they get a big paycheck, right? But the teachers don't like teaching them, and the kids don't like going to them, and the kids don't get anything out of them. But then you come outside of those, and there's public school systems that excel and do a phenomenal job. And everybody likes sending their kids there. Everybody tries to get their kids there. Like Bremen's a perfect example of that, where people try to move to Bremen to get their kids to go to Bremen schools. And so, my solution, okay, so one side says, hey, let's make education and private education all free. And I say, okay, well, there's some value to that. Why not give everybody a school voucher, 100% of the population a school voucher, and then they can give money to Bremen City schools. If they're downtown in a crappy school, they can support a private school with their money.
Do you consider yourself an independent? Are you going to be Republican or Democrat?
So from a political affiliation standpoint, I am more of a political independent. I'm going to pick the Republican Party as the lesser of two evils to run under, because I think the number one issue long term for driving poverty is hyperinflation in government spending. And I think the Republican Party does a little bit better job than the Democrat Party. Not much, just a little. So that's why I said the lesser of two evils. Well,
this also, you've talked balance. I mean, your ideas and things you talk about are so balanced. Can that be successful? I mean, in this climate, to be balanced? I mean, are you going to get enough people to listen to you explain things from both sides and be rational about it?
I mean, maybe. I hope so. I mean, it's one of those things where you can just come in and give some opinions and give some ideas, and they can either take it or not.
Yeah, and
then I can say, hey, I ran.
Yeah.
I got creamed. I hope y'all listen to some of my ideas. Maybe one of them make it all the way to the top, but if it doesn't, no big deal. It's
unfortunate it didn't have more time. I mean, I knew we'd be able to talk for a couple hours about things, but in the last 2 minutes, what will be a successful campaign? If you kind of joked that hey, if I don't win, it's okay, but could you still find a way to make that campaign successful that you'd look back and say that was successful, I didn't win?
Oh yeah, absolutely. I think that's why I'm running. I don't have a massive political machine and a pile of money behind me right now. But if I can just bring up a couple of ideas to the state level where someone in charge that gets into that leadership position say, hey, Brent Harris came up with this really good idea during the campaign. Let's work on that. Let's, allocate some resources and funds to it and make that happen. That'd be a success.
If you wouldn't win, would you continue to find political? I mean, because you did run for city council a couple of times. Would you continue to find ways to serve the community politically?
Oh yeah, I think it's one of those requirements that I think more people need to get invest their time and effort into. I think if people that care about the country don't get involved, and so this is everybody out there listening, and it could be 5 people or 10 people or 100 people. If something that I say intrigues you or you want to support me, come support me. Or if you find somebody else that intrigues you, go support them and allocate some of your time and resources to it to make it happen.
30 seconds left. If somebody wants to help you with your campaign, support you somehow.
Yeah, you can. I don't have an official website up yet. I'll come back, I guess, and give that. You can go to my Facebook page and look at that political Facebook page. Comment on that.
Yeah, it's Brent Harris, Governor 2020, something along those lines, and they could comment there, send you a message
there,
on
their information. Yep.
Well, good. I mean, good fun. It is exciting. It's cool to think of somebody locally running for that higher office. But boy, West Georgia, it really is represented well throughout the state. So it would be cool to see somebody else up there.
We'll see.
Dr. Brent, thank you.
Thank you for having me.
Absolutely. We appreciate you listening this morning to the WLBB Community Voice program. For tomorrow's program, Josh will be back in this seat, and I think we'll decide if we're able to access Facebook Live for that program, but we'll hope you'll tune in for tomorrow's Community Voice at 8:30. Stay tuned now for national headlines, followed by your local news, and Glenn Beck is on the air. Have a great Thursday, everybody.